Hi, I'm Wendy and I'm a nurse. And guess what I got for my birthday? I got a present from the government. I got a poo test. So with my poo test, what I'm hoping is that we can start to reduce Australia's label as being the highest incidence of bowel cancer in the world and in one of the top 10 countries for deaths from bowel cancer in the world. Now you might think that this is an old person's disease, but sadly it's not. The rate of bowel cancer for people over the age of 50 has increased by 30%. But the rates of bowel cancer for people in their 20s and 30s is steadily increasing by 3% a year. Now, for most other cancers, let me put this down. For most other cancers, you get some sort of telltale sign, like for having a persistent cough that won't go away. The doctor might do an X-ray and try and rule out lung cancer. If you're getting persistent headaches, the doctor might order an MRI or a CT scan to see if you have a brain tumour. For a mole that's changing on your skin, the doctor might do a mole map and see if you've got skin cancer. They might remove the mole and do a biopsy on it and see if there's skin cancer cells. But for bowel cancer, it's a bit different. Often there are no symptoms whatsoever. And so the only way we're going to pick it up is if we get tested. Now, it's a little bit like this current thing we're going through, that if you don't test it, you don't find it. And the same thing happens with bowel cancer. Now, for those of you who know, my partner died of bowel cancer. So I, for one, am going to do my test. Now, I haven't had a look at it. So let's open it up. And comes with instructions. And it comes with 2 little vials. So you have to do 2 tests fairly close to one another. So if your normal bowel motions are every day, you would do 1 in consecutive days, but you have to store the first one in the fridge. I might try and disguise it so my son doesn't see that there's poo in the fridge. They have, and this is brilliant. Okay, so this is a toilet liner. And so you put it in the bottom of your toilet. So for men, it's probably a bit easier that when you go to do a poo, you're actually not weeing at the same time. But for women, we often wee, and a little bit of wee comes out when we do a poo. So this is designed to be put over the base of the toilet, just where the water is. And when you do the poo, now in Australia, our toilets are actually quite funny. And I think ours are the majority, and the US is the unusual one. In the US, the water rises right up to the top, whereas in Australia, the water's right down at the bottom. So these can actually sit right at the water level and catch the poo so that you can do the sample. So, and they give you an envelope to send it back in with. So you're not going to see me do the sample. I think that's a bit gross. It's not like one of those 23andMe tests where you can see someone spit into a cup. I'm not going to show you scooping up my poo. Anyway, so having a bowel cancer test tests for what's called fecal occult blood. So that's if there's any blood in your stools. Now, in this little booklet that comes with it, it shows you a diagram, and now I can't find it. It shows you a diagram, and I'll put that one up, and it shows how the lining of the bowel goes from normal cells developing an abnormal cell, and then they multiply. Then it becomes a polyp, and then that starts to invade the surrounding tissue and it becomes bowel cancer. Now, there are two types of polyps, so that's the step before it starts invading the rest of the tissues. There's one that comes up on a stalk, and they can just go in and nip it off and the polyp's gone. But there's another sort of polyp that looks a little bit like a cat's eye on the road. And what they have to do is take a little bit of the bowel either side in order to make sure they've got all of it. They can't just pinch those ones out. Now, then they just stick the ends of the bowel together and off you go. Life's happy. But now up until that point, you might not have any symptoms. The only symptom that you might have is that those cells become a little bit more irritated and they bleed a little bit into your stool. So that's what this test is designed to do. It's designed to pick it up before the cancer starts invading your body. So I'm going to test it. You're not coming with me. So I've decided to hide it in the envelope, and it needs to go in the fridge. And I think the best place to hide it is in the vegetable crisper. So how come Australia has one of the highest incidents of bowel cancer in the world? And we're not on par with the United States or England. And that's a bit of a conundrum. Why is Australia higher than other Western countries? Now, one of the things they look at is what's happening in the bowel and whether the bowel can adequately move food around it. And that's called peristalsis. It's a bit like the muscles pushing it along. And if you have a really refined diet, so lots of processed foods, then the bowel's got nothing to push through. It's a little bit like squeezing a plastic bag full of glue. It just kind of squishes out both ends. Whereas if you've got something a little bit more solid because you're eating a bit more fibre, your food's not as processed, you're eating more vegetables, more greens, carrots and broccoli and peas and those sorts of things, there's a bit of substance. So when it goes to push something through, there's something of substance to push through. Now, the other thing Australians like to do is drink. Now, drinking, not only does it paralyse us, but it has a really significant impact on the bowel. So you'll either go one of two ways. There's a term in Australia called the Grog Bog. And so the next morning you wake up and everything in your bowel just empties, and it's explosive, it's terrible. And the incidence of Australians drinking, and we may in fact see a spike in bowel cancer rates because of the pandemic, because people are staying home and they're drinking more. Now, the alcohol, it's acidic, it's not good at all for your bowel. And so if you want to really look after your bowel and reduce your risk of getting bowel cancer, eat a really healthy diet, minimise processed foods, don't have so much alcohol, perhaps 1 or 2 glasses every couple of days is fine. Get plenty of exercise. The muscles in your bowel are only as good as the muscles that are surrounding it. And if you're carrying a few extra pounds or even more than a few extra pounds, then that's not going to be good for all of your systems inside to try and work properly. So if you're going to go to the doctor, you've got to know what you're going to the doctor for. So keep an eye on what's happening with your bowel. So do you go every day? Do you go every second day? Are they normally quite firm? Are they normally quite soft? Do you normally get pain with it? Has there been anything that's changed? Now, these are the things that you need to keep an eye out for. I know it's going to the toilet. I know it's gross. I know you don't want to think about it. But if all of a sudden you have to go to the toilet twice a day, instead of going every second day, that's a change in your bowel habits. Now, some people say to me, how long should a person go before, they need to do something about it? Now, it's possible that you're just constipated. There are lots of things that cause people to be constipated. Some medications do, not drinking enough water, eating foods that are low in fibre. But if you find that your bowel habits have changed and you've got nothing to explain it, then you need to be asking your doctor to do some examinations. Now, most people, when they get to about day 4 or day 5, they are really, really uncomfortable and need to do something. So when I work in aged care in the nursing homes on the wards, then if we get to about day 3, I'm starting to say, okay, well, let's have some pear juice. Let's have a bit of a drink of something that might encourage the bowels to go through. If we get to day 5 in aged care, we're looking at administering an enema. So day 5 seems to be about the most crucial stage. Now, there are some people who've gone 40 days. There was one fellow who went 13 years. Now, I'll put the picture up. This is 3 feet of this fellow's colon that they had to remove. He had a disease called Hirschprung, and that's basically where the colon is either sluggish or it's paralysed in certain parts, and it just backs up and it backs up and it backs up. Now, this fellow from the outside looked like he was pregnant. So this is a very rare thing, but it just goes to show how important the bowel is to us. And if we don't look after it, then we can end up in all sorts of trouble. So if you've got any changes in bowel habits, if you've got any bleeding, so if you wipe with the toilet paper and you notice a bit of blood, straight to the doctor. If you get abdominal pain that you can't understand, that isn't explained away by foods that you've eaten. I know that if I eat really spicy foods, sometimes I can get a bit of an upset stomach. Then go to the doctor. Anyway, enough of that. I'm going to send off my bowel test tomorrow once I've got the second sample, and then the result will come back and they'll either tell me that it's negative and I don't need to do anything further until they send me the next test in a couple of years, or they'll say, look, there was a bit of blood in it, go to your GP and get checked out. So there are lots of things that can cause you to bleed. You can eat something that causes a bit of a scratch on the inside of your bowel and that physically causes you to bleed. You might have had a whole heap of acidic foods. You might have had a whole heap of alcohol and that's caused irritation to your bowel and caused it to bleed. You might have something like Crohn's disease or irritable bowel syndrome that you don't know about. And so it's really important that if this test comes back positive, you go to your GP and you get it checked out. As much as you say, okay, well, I'm not going to have the test. I don't want, the procedures, because the procedures, they're not pleasant. I don't think any procedure is pleasant and it's invasive. But in saying that, if you don't have those tests and rule it out, there is a potential that you could die from bowel cancer. So please, if your doctor asks you to go and have any of these tests for bowel cancer, go and have them. And the next day, you just write it off, pretend the day actually never happened. All right, look, I bought a new hat. What do you think? I like it. I was visiting a friend and had to stop off and get a few things at the supermarket, and there was a shop across the road from the supermarket and I just had to go in. I like it and it keeps my ears warm. All right, I'm Wendy. Thanks for watching and I'll see you in the next video. Bye.